Medfix Surgical Series, Lower Gastrointestinal Surgery. Introduction. 1. Intestinal obstruction, a common surgical emergency caused by mechanical or functional blockage of the intestine leading to pain, distension, vomiting, and constipation. Requires prompt diagnosis and resuscitation. 2. Paralytic Ileus, functional obstruction of the bowel, due to inhibition of peristalsis, often after surgery or trauma. Presence with abdominal distension and absent bowel sounds, managed conservatively. 3. Volvulus, twisting of the intestine, commonly sigmoid or cecal, around its mesenteric axis, causing obstruction and ischemia. Requires urgent surgical intervention if strangulated. 4. Intussusception, telescoping of one part of the intestine into another, commonly seen in children. Presence with colicky pain, red currant jelly stools, and a sausage-shaped mass. Treated with enema reduction or surgery. 5. Meckel's diverticulum, a congenital remnant of the vitellointestinal duct, typically asymptomatic but can cause bleeding, obstruction, or inflammation, diagnosed by Meckel scan or during surgery. 6. Short bowel syndrome, a condition resulting from extensive resection of the small intestine, leading to malabsorption and nutritional deficiencies. Managed with dietary support, parenteral nutrition, and possible intestinal transplantation. 7. Inflammatory bowel disease, includes Crohn's disease and ulcerative colitis, chronic relapsing conditions of the gastrointestinal tract, with medical management as first line, and surgery for complications or refractory disease. 8. Appendicitis, inflammation of the appendix, presenting with periumbilical pain migrating to the right iliac fossa, fever, and tenderness. Urgent appendicectomy is the standard treatment. 9. Small bowel malignancy, rare tumors like adenocarcinoma, lymphoma, and carcinoid affecting the small intestine. Presence with vague symptoms, obstruction, or bleeding. Diagnosis is often delayed. 10. Colonic polyps, benign growths in the colon, some of which have malignant potential, especially adenomatous polyps detected via colonoscopy and removed to prevent colorectal cancer. 11. Colorectal cancer, a leading cause of cancer death worldwide. Symptoms include rectal bleeding, altered bowel habits, and weight loss, diagnosed by colonoscopy and biopsy. Treated with surgery and adjuvant therapy. 12. Diverticular disease of the colon, outpouchings of the colonic mucosa, mostly in the sigmoid colon, can lead to diverticulitis, abscess, perforation, or bleeding. Managed medically or surgically depending on severity. 13. Hirschsprung's disease, congenital absence of ganglion cells in the distal colon, causing functional obstruction. Presence in neonates with delayed meconium passage and abdominal distension, requires surgical resection. 14. Prolapse of the rectum, protrusion of the rectal wall through the anus, often in elderly or multiparous women. Managed conservatively or surgically depending on severity and recurrence. 15. Anal conditions, includes fissures, fistulas, abscesses, hemorrhoids, and carcinoma, these present with pain, bleeding, or discharge. Management depends on diagnosis and ranges from conservative to surgical. Thank you for watching. Stay tuned for our next episode where we dive deep into intestinal obstruction, causes, diagnosis, and surgical management. Don't forget to like, share, and subscribe. For daily surgical insights, Medfix, surgery made simple.